My name is Dr. William Chance. I'm a sport physician, or often people call me a sport medicine specialist. I work and run a sport medicine clinic in Subang Jaya by the name of Clinic Pakar Sokan. I have been working in Malaysia since 1998. Today, I'm going to share with you my running experience as a marathon runner. We are going to talk about preventions of injury. Now, our first prevention is running distance. Normally, for people who do long distance running or marathon running, they do short run on the weekdays and then a long run on the weekend. Most people have running injury from the knee to the shin, to the Achilles and to the heel. And that's why you need to increase your distance slowly. If you want to increase your distance, you should increase by 10% per week. Examples are if you run 20K on the weekend, you should increase up to 22K the following week. The next tips to prevent injury will be do not run when there's pain. So in running, you can get pain in the kneecap joint, which is very common. This is the kneecap joint. You can also get pain from the tendon, which is in front of the knee. So during the run, you'll be running like this, so there'll be a lot of stress on the kneecap joint. So when you have pain, the body is trying to tell you something is wrong. It's very common for people to have some pain after long distance run on the weekend, like 20K run. If the pain disappears the next day, then usually mean this is normal pain associated with the muscles and also the tendon. If your pain persistent for 2 or 3 days, even resting, then you need to get it checked and you should see your doctors to find out what is the problem, and you have to temporarily stop running. My next point will be do not run with your old shoes. Now, when you run, you need the shoes for protection. You also need the shoes for cushioning. So during the run, most people will land on the heel first. Okay, so the shoe gives you the protection, like cushioning, basically. For 4-foot runner, they tend to run on the front of the foot, so the shoe will give you the protection in the front. Now, why we say not to run on old shoe is that when the shoes are worn out like this, what you see on the pictures here, you had lost the cushioning. Now, most shoes, when you buy new, it gives you about 700 kilometers of distance, like you buy a tire, a new car tire. After 700 kilometers, you lose about 50% of your cushioning. So you need this cushioning to protect and reduce your risk of injury to your legs, especially in long distance runners. Our next point we want to talk about is called cross-training. Cross-training means you use different muscles for training, for your fitness and also for your endurance. In cross-training, like in cycling, you use different muscles and also non-weight bearing, same as in swimming, is non-weight bearing. They mean there are less pressures on your leg in cycling and also in swimming. It gives you fitness training at the same time, you strengthen your muscles. Our next tip will be stretching exercise. You should stretch before and stretch after your running. Now, why you need to do stretching? During run or during training, muscle often get tightened up. So that is why some people get very tight muscle, very stiff muscle, and also very stiff joint from running itself. So this is often the common stretching exercise for the legs. This is the hamstring stretch. You stretch the hamstring, but also you stretch your lower legs. And this is the quad stretch. You stretch the muscle in front. These are the main muscles that you use for running. How you stretch them? You should stretch them long enough for the muscle to relax, which means you should do this type of stretch and hold it for 10 seconds by counting 1 to 10. Then you should repeat 10 times. The scientific study shows when you stretch and hold it long enough, then it does reduce the risk of injury. The common mistake most runners make is they do very brief stretch, just do 1 or 2 stretch, and then they will then start going run.